Okay, so I'm going to do a quick rundown of our valve disorders, and we're going to start off with mitral valve stenosis. So what is mitral valve stenosis? Well, we know that mitral valve stenosis is the thickening and shortening of the valve. It's also described as a fish mouth-like appearance. So you can kind of use that image in your head to differentiate between a healthy valve and what a stenosed valve looks like. But in case you kind of have a hard time and you're like, what does that mean? I drew these right here, right? So this is what a healthy valve looks like. A healthy valve kind of looks like a smiley face. It's really opened. It's really wide. It's going to allow that blood to go through. Whereas like a stenosed valve is going to be more shorter and more narrowed, and it's not going to allow as much blood going through, right? So that's how you can differentiate between the two. Also, just want to note that your mitral valve is right here on the left side of the heart. So I drew this little diagram so you can kind of picture it, that we're talking about this part right here, right? Okay, so let's talk about some things that may cause mitral valve stenosis. Our number one cause for mitral valve stenosis is going to be rheumatic heart disease, but some other causes may be congenital heart anomalies, obviously, and oftentimes I see SLE like written in our PowerPoints. Essentially, SLE is just lupus, the autoimmune disorder lupus, and another cause can be RA. Also, one thing to note with mitral valve stenosis, this puts the patient on increased risk for atrial fibrillation, and this is due to the fact that there's increased pressure on that atrium, right? So talking about that, you know there's going to be a pressure difference between your left atrium and your left ventricle. Just kicking off from that real quick, since we know that, you may also see differences between your right ventricle pressures and your left ventricle pressures. So your CVP may be a little bit more differential than what your PLOP is going to be, simply because they have this mitral valve stenosis. There's not as much volume going into that left ventricle, right? Also, with that being said, we know that increased left atrium pressure can cause increased pulmonary vascular pressure due to the fact that, there's more pressure building up in the atrium. So what are some signs and symptoms that we'll see with mitral valve stenosis? Our key ones are going to be exertional dyspnea. So it's anything that the patient can do that's exerting themselves, climbing the stairs, going for a walk, simple things like that. They may have heart palpitations and fatigue. And other signs and symptoms are going to be chest pain, hoarseness, or hemoptysis. I can never say that right, but essentially that just means that the patient's coughing up blood. Another thing to note is that anytime you're listening for murmurs are best heard at the apex of the heart. So that's a quick rundown. Just dirty little notes. Okay, on to the next. Okay, so let's talk about mitral valve regurgitation. So we know mitral valve regurgitation is primary or secondary damage to a structure, and this essentially just causes backflow of blood due to the fact that these valves are not closing tightly like they're supposed to. So here I tried to draw my best little diagram of what a valve is supposed to look like. So here you see with the healthy valve, they're closing tightly like they're supposed to, but here when you have damage to the structure, it causes these valves not to close as tightly as they normally do. It kind of leaves like a little bit of space, right, to allow blood to go back up. With that being said, we know that there's risk for rupture when we have a patient who has an MI that has left ventricular failure. And they're like, oh my God, how does that make sense? Break it down even more. You know that you're having a myocardial infarction, specifically in the left ventricle. So once you start having all these infarctions and say you don't treat it or the damage is already done, then that necrotic tissue is going to spread to other places. So if we have necrotic tissue spreading in this left ventricle and it gets to where these papillary muscles are connected, well, how are these getting perfused and how are they getting contracted if that myocardium is deceased? It's not. So it's going to cause these muscles to have a prolapse or rupture. So essentially that's how you know that if a patient with myocardial infarction that's specific to left ventricular failure, you know this will be an increased risk for prolapse with the mitral valve. Now moving on, we know that mitral valve regurgitation is broken up to two different categories. So let's talk about the first one, specifically acute. We know that acute is rapid. So what are some things that are going to cause acute mitral valve regurgitation? Well, we know that rheumatic heart disease from untreated bacterial infections can cause this. And just off the top of your noggin, hearing that first one, we know that something else can cause it without even thinking about it. Endocarditis, right? So endocarditis, and then obviously after an MI can cause this regurgitation because it's sudden and it's quick. What are some signs and symptoms that we may see with an acute mitral valve regurgitation? 30 peripheral pulses, cool and clammy extremities, right? Okay, moving on. Now we have chronic. Chronic is not sudden. over time. And another thing that I put on here is chronic is normally asymptomatic for years. What are some things that can cause chronic mitral valve regurgitation? Mitral valve prolapse, coronary artery disease, autoimmune diseases, heart arrhythmias, and connective tissue diseases, right? Also to note with this, treatment's based on cause. So you may just recommend your patient have some lifestyle changes, less sodium in their diet, doing less exertional activities. You may prescribe medications such as ACE inhibitors, beta blockers, diuretics. And if it's severe enough, you may need surgical intervention. So that's the quick and dirty rundown of mitral valve regurgitation. Okay, on to the next little quick and dirty rundown. Let's talk about mitral valve prolapse. So we know mitral valve prolapse is an abnormality in the structure that's causing the buckling of valves, right? What can this be caused by? It can be caused by connective tissue diseases or infection. And here I didn't draw, but it's my old healthy valve that doesn't look good. And here's a prolapse valve. So as you see, all these papillary muscles are connected here. And then with the prolapse valve, you may have a few that are connected, but there's a prolapse where the other ones are not connected. So it's completely like a buckling of a valve. It's not closing like it's supposed to, right? Way we can diagnose this is with an echo. As far as signs and symptoms go, they're normally asymptomatic, but they can present with chest pain that doesn't respond to nitrates. Now, with that being said, mitral valve prolapse can obviously lead to mitral regurgitation because these buckling valves are causing blood to go back up into that atrium. Some other things it can lead to, like I said, it's can be caused by infection. So it can cause infectious endocarditis. It can also lead to sickle cell disease, heart failure, and cerebral ischemia. As far as treatment goes, we're going to tell them to limit their caffeine and stress, tell the patient to hydrate, and we may prescribe them some beta blockers. Well, we won't, but they may be taking beta blockers. Okay, aortic valve stenosis. So we know that aortic valve stenosis is obstruction from the left ventricle to the aorta. So we're talking about this area right here, specifically this valve right here. Some causes. This can be due to calcium buildup on the aortic valve over time. Also want to note that this is the most frequent degenerative valve disorder. Yes, I spelled degenerative wrong. My bad. Here I drew what a healthy aortic valve is supposed to look like and then what a stenosed aortic valve looks like. So here you see that it's opening fully and it's shutting completely. And here it kind of barely opens and here it doesn't shut all the way that it's supposed to. So this is usually congenital. With our older patients, it may be due to RF or just degeneration over time. Signs and symptoms, it's going to be angina, syncope, and exertional dyspnea. As far as treatment goes, we want to use nitro very cautiously. And then key thing to note with atrial valve stenosis is that it can lead to pulmonary hypertension and heart failure. Cool. Okay, last one. Quick rundown of aortic valve regurgitation. So we know that aortic valve regurgitation is retrograde blood flow from the ascending aorta to the left ventricle, and this can cause fluid volume overload. This is normally due to a diseased leaflet or aortic root. It can be caused by infective endocarditis, trauma, or aortic dissection. As far as signs and symptoms, so if it's a sudden cardiac collapse, we're going to see dyspnea, chest pain, hypotension, and then this can also be chronic, usually due to rheumatic heart disease, congenital anomalies, syphilis, etc. If they're chronic, they're normally asymptomatic for years, and this specifically will have a water hammer pulse, and that's specific to aortic valve regurgitation. So yeah, that's quick and easy rundown of that. Bye for now.